Hello and welcome to today's episode of Health University, where I have the good fortune and pleasure of introducing Dr. Lynn Westfall. And Dr. Westfall is not only the CMO, Chief Medical Officer of Kindbody, a amazing group of IVF centers across the country. And is it internationally yet? I don't know.
No,
Across the
just in
country.
the US at the moment, but
Okay,
hopefully.
that's right. And Professor Emerita at Stanford University. So she brings a wealth of information from just her time in the field and then her expansive body of knowledge. And I'm so grateful that you took the time to speak with us today, Dr. Westfall.
Well, it's a pleasure to talk to you. Thank you.
My pleasure. I got excited and reached out to you because I had heard about Kindbody developing the Kindbody Institute, which I'm going to ask for you to first introduce yourself if there's anything that I missed, but also give us an explanation of what is Kindbody Institute, because it is avant-garde. And as far as I'm concerned, I've not seen this occur anywhere else in the field, and I think it's very exciting. So please share with us a little bit more about yourself if I missed anything, and then about Kindbody Institute, and we'll just kind of riff from there.
Thank you. I'm a obstetrician gynecologist and reproductive endocrinologist and practiced at Stanford for over 20 years and then retired from Stanford. So I still have like a academic appointment there. And then became the chief medical officer at Kindbody. And one of the reasons why I was interested in joining Kindbody is that, as a new company, could think about providing care and improving access to care in ways that are difficult to do in a really big institution.
Right.
And the Kind Institute for training gynecologists to help with fertility procedures, I think is one of these novel things that we're able to do. So there are training programs, 3-year fellowships for reproductive endocrinology, but there aren't enough training spots for all the physicians that we need to do fertility services. And, over the years, we've had advanced practice practitioners who have been helping also in the field. And then there were gynecologists who were trained sometimes in small clinics to assist with some of the reproductive endocrinologists. But there hasn't been any really formal training for these gynecologists who are interested. And, every year there are gynecologists who sometimes don't get into a fellowship or have an interest in learning fertility and have practiced for a while and want to learn some new skills and just focus on the fertility space. So this program is a formal program that we're doing at several of our centers. There's extensive didactics, and then every gynecologist has a mentor who works with them to make sure that they're able to do retrievals and transfers. And, so by the time they've completed their training, they've usually done more retrievals or transfers than someone would have done in a fellowship. So they're very well trained to assist the reproductive endocrinologists.
Beautiful. And oftentimes, these gynecologists are the first line, if you will, of a woman inquiring, I'm having some difficulty, what do I do? So to be able to get some real, hands-on and immediate response, I think becomes a relief to the woman, to the person who's inquiring, because otherwise that person can be saying, okay, I'm having trouble, and then be referred out. And depending upon the wait list, it can take some time where that person may feel, I'm going to use the term she, does not have that much time. So being able to get started in these processes, I think, is only going to be a relief for everybody. Do you envision these gynecologists, once they're trained and graduated, will they be using the Kindbody clinics, if you will, for their procedures, or will they have these procedures in their own private practices?
So these gynecologists were training to work with the reproductive endocrinologists in their clinic.
Mhm.
So wherever they're trained, they will be staying and being part of the fertility team.
Beautiful. So that so retrievals, et cetera, will continue, will be in the physical location of the Kindbody
Correct.
clinic.
Right,
That's
right,
beautiful.
right,
Yeah.
right. So all the care, the management is still overseen by the reproductive endocrinologist,
Mhm.
but then this allows the reproductive endocrinologist to focus more on the more complex things, and then the gynecologist can help with the procedures in the
Mhm.
clinic and to help get more patients in.
Right. Right. So more the REI will do more case management, if you will, and kind of mentor and review,
Right,
and
right,
make recommendations for what procedures and in what order and so forth. That's
right.
fantastic. And has it rolled out? Or, I mean, I saw the announcement, and as I said, got very excited. So has it rolled out? And if so, in which clinics? So which area of the country can folks plan to get to right away?
Yeah. So the first cohort is just completing their training. So we had someone in New York who already had been doing, she had worked in a practice where she had already done thousands of retrievals and transfers. So it was just, kind of getting her into the Kindbody way.
Mhm.
And then we have a gynecologist in San Francisco who's an amazing surgeon. So she's, a minimally invasive gynecologic surgeon, someone who can handle any complicated surgical procedure.
Yeah.
And so she's been finishing her training. And then there are a couple of people in Chicago who are kind of finishing their training.
That's wonderful. And is it how long what is the duration for the training for this mentorship?
A minimum of 6 months.
Of course, depending upon their level of expertise when they come in. Yeah, that's
Correct.
wonderful.
Right.
And how do you expect this to, and how many clinics does the Kindbody group have?
So we have 32
I knew
right
it was,
now,
I
and
knew it was a
we're
big
adding,
number.
yeah, we're adding a few in the next few months.
Mhm.
So should be up to 35, 36 in the
That's
next few
amazing.
months.
That's amazing. And for the listening audience, Dr. Westfall, as I said, is the chief medical officer. And so therefore, do I understand it correctly that you are licensed in every state in the country?
Yes, yes, I
That
have.
must have been quite an undertaking and and
Yeah, I
quite an
have 51.
administrative upkeep to just keep those licenses going.
Yeah, I have 51 medical licenses, so all states, and then DC is a separate license.
Okay, that's amazing.
Yeah, it does take take time to keep up because different states have different regulations and
Right,
the CME requirements. So
right.
it does take some time,
Yeah, you
but
need
it is very
your own EA just to manage to make sure that your licenses are up to date because I'm sure they're not all renewing at the same date.
right. And
It's like
some
having
are,
a perpetually rolling tax year.
yeah, and some are every year, some are every other year, and yeah, they're
Mm-hmm.
different times. So,
Mm-hmm.
but it's been really kind of fun for me to see and meet people all over the country, and there are differences in in the patient populations, and
Sure.
just their expectations, and some areas where I'm talking to people, they're so far away from any medical care that
Mm-hmm.
just getting like basic testing and things like that ordered can be difficult.
Yeah, wow. And you mentioned the phrase the Kindbody way. And I know that that's a phrase that I've heard before, and I'd like to make sure the listening audience understands what does that mean in Kindbody? What is the Kindbody way?
We try to have standardized protocols across all the clinics.
Mm-hmm.
So we have very extensive protocols that people can look at for any type of procedure or any type of situation that may come up. And so we revise these as needed. We are always trying to have them, with the most up-to-date recommendations. And this way, it's just a good resource for people, and we know that everyone's following similar protocols.
Beautiful. So it's standard operating procedures for the procedures themselves, but maybe I was making it up. It seems to me that Kindbody as a way also is more embracing and inclusive of ancillary cares, psychotherapeutic, myself, natural medicine support, so that your patients are really not feeling like they're getting a divide and conquer, or being told to stay away for 3 months while I go give you these herbs, which only creates stress for everybody. I love the fact that Kindbody as an institution from the get-go has been saying this is a need that can be met with a variety of input. And I really appreciate that, unlike others that are saying, oh no, anything other than what we're doing is of concern. Let's put it that way, because they're variables that doc may not understand or know what to do with. But the intention and the mission seems to be that Kindbody has been embracing, sort of the holistic approach to patient wellness.
Yeah, absolutely. I mean, we know that, a lot of patients drop out of care because they find it so difficult from like an emotional standpoint. So anything that can help the patient feel supported as they're going through the process, we totally embrace, because, we want people to be able to build their families, and, and everyone approaches it differently, right? Some people, want to move more slowly. Some people just want to jump right in. And so we want to make sure that we're, tailoring their treatment to what feels comfortable for them. And also that they're doing whatever other treatments that they think will help them through the process.
Yeah.
Right.
I
So
know
like
that
acupuncture is something that, a lot of patients find that they feel, so much better when they're doing it. Some of my patients who've been, really nervous and stressed, they're like, oh, I have like the best nap, or I feel so refreshed after I have my acupuncture. And those types of things are so important. They just help the patients get through the process. So,
absolutely.
Anything that makes them feel better, we
Absolutely.
totally embrace. Yeah.
I will just speak for myself, and and working with all of my patients, but I'm thinking in mind of specific Kindbody patients who I've had the pleasure of supporting. Sometimes it's simply translating, because we have the time to sit and say, oh, this is what you're doing, this is what's happening, and then you can just watch the cortisol levels drop as they begin to comprehend, oh, I can understand this, I can, and therefore I can engage with it, and therefore I'm not as stressed, and then therefore with my acupuncture treatment, I am getting better blood flow to ovaries and uterus as we're doing the protocols that are designed to do just that. And we're also then talking about the sort of the lifestyle medicine that helps this person, just improve their life and their whole health, and then therefore the reproductive health, because if we're either delivering what I jokingly refer to as Twinkie blood, or we're referring or we're directing nutrient dense blood flow to the tissues and the organs at hand. So yeah, that's wonderful. That's wonderful.
Yeah, and I think it's nice for the patients, right, to have some other perspectives too. And right, the way that you explain things may be a little bit different than the way I explain them, right? And patients sometimes will find that hearing it different ways, then they're able to understand, and
Absolutely.
and it resonates a little better.
Absolutely. Are there any I'm going to use the term cautionary, tales or messages you would like to give the person out there listening, to say, before you, or as you plan to, come into a Kindbody or make your first Kindbody appointment, you might want to consider ABC first, or is it just give us a call and we'll help you out from the get-go?
Well, I think making that call or appointment is often, a bit of a big step to take, but I think that's probably the most important thing. Just go in, find out, your basic fertility. I there are patients who sometimes, think they need to do all this preparation in advance, but, there could be some other factor that's, really important. And so you don't want to lose time. I think
Thank you.
that's the one thing that
That's what I
um,
was hoping
I,
to hear you
I would
say.
I would caution people, because sometimes, there are people like, oh, I've been like, trying to prepare and be as healthy as possible for the last 5 years, and and now they're 45, and it, I mean, that's all great, but time is going to become an issue. So you know even if you're not planning to do anything initially, it's good to find out if there's some other factors that maybe need to be addressed.
I couldn't agree more. And then that was actually a little bit of a prompt, because I was hoping to hear you say that, because, we who are, as you well know, fellows of the Acupuncture and TCM Board of Reproductive Medicine are on the same page. Where, we're not the ones saying, give us 6 months to a year to get you ready, because we know that window may be the critical window. And, heaven forbid someone's getting you ready and there's a structural impediment. Or, and certainly if there, even if there's a physiological paradigm like a PCOS person, they could really benefit from getting the numbers and getting getting markers in. We go to the doc for other markers. So the idea that we would wait and not go in and get our markers for our fertile health is, it kind of breaks my heart sometimes when I have women come in and they've been doing the 3, 6 to a year time frame. And I understand from their perspective, they're afraid. And all they needed to be told was, it's okay. There's no harm in getting your baseline. You get your teeth checked every year. So yeah,
Right.
yeah,
Right. Yeah. Or you go in for your PAP, right?
exactly.
And, there's always the chance of finding something
Yeah,
unexpected.
yeah.
Um, and so I understand it sometimes being a little bit scary to go in, but, you know, there's a lot of power in having this knowledge.
Absolutely. And in my observation in the last 23 years, most of what even might get uncovered that might feel scary can be remedied. Like that's what the procedures are for, so that you're not saying, uh-oh, why am I not menstruating? Uh-oh, why do I have this terrible pain at either ovulation or menstruation? If there's a reason, if there's a physical and physiological reason, that can be attended to. So why suffer longer than is needed, especially when
Right.
that time frame, as you say, could be the window of opportunity that could, bring their heart's desire. The other thing that I would like to add for the listening public out there, and I'm going to bet you agree with me, is that one of my first questions is, how many children do you want to have in your family when they're coming, when they don't have,
Mm-hmm.
one already? Because, if they want 2 or 3, then there may be a real advantage to first getting your embryos,
Mm-hmm.
freezing them, testing them, whatever. And then even if you say, then I want to try naturally, well, go for it. Then you've got your insurance policy in the bank that you have embryos of age, we'll say 35, when you're 40. And so, and that is a better likelihood for a healthy pregnancy. Do you have see that kind of dilemma as well, where a woman has waited, has said, well, I'm just going to try this one time. And, then it takes some time and she gets pregnant, and then she's nursing, and then she's starting again. And that's when, then she has to go to donor eggs because her window is closed.
Absolutely. That's an important conversation to have early on.
Mhm.
And I, see patients who are getting further into their 30s and they say they want to have 2 or 3 children. Before they try, it does then make sense, to freeze some embryos or eggs, and then hopefully they'll get pregnant quickly. But then, if they try to have their second or third and they're in their 40s, then they have this as a backup. So
Right.
it's really important for family planning to think about, the age that you're starting and the age that you think that you're probably going to end. And, if having something frozen in advance would help with that plan.
Couldn't agree more. The other factor, the variable that has come, well, two of them have come in. One, the most recent change to the diagnosis for infertility, I think has opened up a lot of opportunity for more people to have your services. And then the second point is that there are more companies, corporations offering fertility benefits as part of their benefits package plan. So, think about that, listeners. If this is something that you want as part of your life, is to have a family, kind of think about getting lined up for that, so that you're not in the queue when you already feel like it's too late. Because truly, as much as you can take 1 ounce of stress away from the process by just getting things done in advance, it makes a world of difference.
Yeah. So hopefully more companies will start to add these benefits. And, if someone's at a company where they don't have a benefit, it's worthwhile, to talk to the HR team to see, if this is a benefit that they would think about adding. And we have found, because we're able to offer employers a pretty good, rate for doing this, and it obviously produces a lot of employee satisfaction. So there are sometimes ways for employers to add these benefits. Now, again, it
Without
also
going to the
benefits.
large insurance companies, they can go direct to you.
Yes, yes.
I
So
I
that's
just learned
actually,
something today. I
oh,
did not
yeah.
know that. I want to repeat that if you don't mind, because I think that's key. Because this is my field, and I did not know that Kindbody had a direct to company, policy, if you will, or program, so that company doesn't have to go out to the big insurance companies and pay, possibly big premiums and pay 3 times the retrieval. That's wonderful. Are there parameters? Should the listeners be thinking about, companies over 50 employees or companies over 500 employees that Kindbody tends to work with, or?
So we tend to work with like bigger companies. They tend to be a little bit more interested in doing this too. But we tailor the benefit to what the employer wants. So for example, our biggest employer is Walmart.
Oh, that's a big one.
That's a big one. And Walmart did not have a fertility benefit, but we were able to provide pretty cost-effective benefit for them. And it's, something that has been, I think, life-changing for so many of these employees. And so the Walmart benefit is done similar to some of their other medical conditions where you have to go to certain clinics. And so the Walmart employees do come to one of the Kindbody clinics for their care, but they do have a benefit to do that. Some employers, though, want to have even more flexibility, or if they have employees that live in an area not close to one of our clinics and they want to go to a different clinic, we do have partner clinics too. So depending on what the employer wants, we can make a package to help
That's
them
beautiful.
with their
And I
employees.
presume that you probably don't want to be fielding all of these calls. So is there, who might an HR benefits director reach out to at Kindbody to inquire more, or is it just go on the website and
so if you go on the website, there actually is an area, if you're like an HR person, if you're interested in learning more. So they just go to the website, they can just contact them.
Excellent. That's wonderful. Well, boy, I just learned something new. I love when I've learned something new. And here again, this is where I know I feel like I'm just rah cheerleading, but this is not typical in at least in my observation. Now, granted, I'm only in the San Francisco Bay Area, but I've been doing it for 23 years. And so I've been seeing a lot of the evolving of how reproductive medicine is being offered. And this seems, I'll repeat, avant-garde to me. Are you aware of any other company that is doing this?
Yeah. No, there's no other company that has clinics that contract directly with employers. And because we are all across the country, we're able to support most employees.
That's beautiful. What other thing would you suggest that, again, I'll use the term woman, a woman or person, do to prepare so that by the time she's having her initial consult, your staff and your docs are not are feeling like they can make the most efficient use of their time on behalf of this person?
Um, well, so I think, in preparation for, any type of fertility treatment, whether, doing IVF or doing egg freezing, we touched on this a little bit earlier, just to try to have as healthy of a lifestyle as possible. So, stop smoking, um, minimize alcohol, try to be a really healthy weight, exercise, all these things that are important just for long-term health. And these are also things that are really important in pregnancy for having a healthy pregnancy. So, in this preparation, right, this is a good motivation to be as healthy as possible. And those are, good habits to have,
Right.
forever.
Absolutely.
Yeah. And kind of correlated with that, you know, doing the treatments, sometimes is a little bit stressful. So finding ways to manage stress, everyone has kind of different ways of doing that. And some of my patients find that the acupuncture is a great way. But some people do
You can take a
meditation
walk,
or
exactly. You
take a
can take a
walk.
walk with a
Yeah.
friend or listen to a meditation. Yes, it's there.
Yeah.
There are many, many ways to get there. I actually just had a conversation shortly before we got on the phone together on Zoom together about this preparation, and part of our conversation sort of expanded to things like, yes, eat a healthy lifestyle, pay attention to your hydration, get proper circulation, get good sleep cycles
Mm-hmm.
going so that all hormones are flowing along their circadian flow, but also pay attention to the clothing that you're choosing and the personal care products that you're choosing, because there are a lot of environmental, or let's put hormone disrupting environmental toxins in wrinkle resistant or water resistant clothing or stain resistant clothing, or the gel nails you're putting on your fingers or things like that. And I don't know, I can't say for certain that, that's going to be the impediment, but I guess my argument would be take away as many of these toxins as possible, and you're going to improve egg quality. Because at the end of the day, while egg quantity can infer egg quality, there's not an equal sign there. And egg quality is something that a person can actually make changes to lifestyle to improve, or likely improve. Here again, there are no guarantees in life, period. But the logic is there and the science is there that, we really kind of are what we eat and how we live.
Right. So you definitely can make your quality worse. If you have a healthy lifestyle, you're eating well, you're at a healthy weight. Unfortunately, there's nothing that can like really supercharge your fertility. But you know, just being as healthy as possible is the most that you can do. And the other factor though is just age, as we mentioned earlier. So overall, the best predictor of quality is age. So even if you have a healthy lifestyle, we know that, as you get further into your 40s, you could be the healthiest person in the world, but the quality is going to start to
Exactly.
decline. So we
Absolutely.
know
You're a
by the
healthy 40
time,
year old, but you're,
right,
fully, you're
right.
reserve.
So you,
Mhm.
right. So you can feel still very fertile, but we know by the time women are 40, over half of the eggs are already chromosomally abnormal.
Mhm.
And there's nothing that you can do to change that. That's just,
Correct.
basic
Life,
biology.
biology, nature and life. Yes, for sure. For sure. Well, I want to be respectful of your time and the listeners' time, but before we wrap up, is there anything that I didn't ask about that you would say, oh, these folks need to know this before I sign off?
So one other thing that maybe can help reduce the stress is just to know what your benefits are. So, look to see if you have coverage. the unfortunate thing is that it varies from state to state. So there are some states that have good coverage, some states that have none. And like in California, it's really variable. It depends on the employer. So there's some employers that add a fertility benefit and some that don't. But knowing and understanding your fertility benefits, I think then helps as you go through the process. And the other resource that I would recommend for people who may need financial assistance, the Resolve website has a list of grants, and there's some that are national, like Baby Quest, and then there's some grants that are just focused for certain states or certain populations. So I would definitely, look at the Resolve website.
Resolve. Okay, I'll put all of this in the show notes. So listeners, if you're interested, look to the show notes, and I'll have links to the Resolve site and things like that, and as well as the Kindbody site for the HR directors who want to reach out to you directly.
And then also ASRM, which is our professional organization, has information for patients too, and that is a very trusted resource. I would recommend that people not count on Dr. Google for answering their fertility questions, because there's just a lot of misinformation on the internet. So I would use
Google,
a trusted,
or there's social groups, or the so-called support groups can become they can be wonderful, or they can become a rabbit hole. Yes. So yes, go to a trusted authority. And the ASRM stands for the American Society of Reproductive Medicine. So once again, I'll put that in the show notes as well.
Great. Thank you.
Thank you. Well, Dr. Westphal, thank you again so much for taking this time. I know with 35 clinics, you're a busy gal, so I really appreciate you taking some time to speak with us today. And I hope to get you back for...
Yes, it's wonderful that you do this.
Yeah, well, thank you. I hope to get you back for a do-over or an update at some point in the future.
Anytime. My pleasure.
Thanks, listeners.